Hi, I'm Emily.
And I'm Amelia. Hi, Professor Richard. Thank you for joining us.
We are health ambassadors for Down Syndrome Australia. Today we are going to ask Professor Michael Richards a few questions about the COVID-19 vaccine.
Hi, Emily and Amelia. Thanks very much for having me today.
What is a vaccine?
A vaccine's a type of medicine that we take to prevent a disease, not to treat a disease once it's started. The vaccine is clever in that it trains the body's immune system, and the immune system is the way that our body fights off and prevents various types of infection to block a disease that we haven't ever seen before. And we need a different type of vaccine for every different type of disease, infectious disease.
How does a vaccine work?
Well, most vaccines are given as a small injection into your arm, and your body is tricked by the vaccine in that injection to train up your immune defense system against the type of illness that vaccine's been particularly designed for. The body in the bloodstream produces these things called antibodies and other sort of complicated defenses against that illness. And remarkably, it's able to remember the infection and remember how to produce those antibodies for a very long period of time afterwards. These antibodies and other defenses just sit there for ages, but they'll swing into action if you meet someone with that infection. And they'll block that infection being transmitted to you. In other words, as a result of that immunization, you stay well, whereas otherwise you would have got sick.
Are people with Down syndrome more at risk at getting COVID?
Well, from what we know so far, people with Down syndrome are at the same risk of COVID-19 infection as other people. But if they get the infection, there's a greater chance of it being more severe. And that's because their immune system, the immune system in people with Down syndrome, doesn't work as well as it does in other people. And also, people with Down syndrome are more prone to getting chest infections and to having heart problems that really complicate this disease when it happens. However, it's worked out really that people with Down syndrome have generally been so cooperative with all the different measures that we've had to try and prevent them getting infection. Things like wearing a mask, staying a distance away from other people in public, complying with isolation recommendations, that around the world, the number of people with Down syndrome that actually get severe COVID infection has been very small.
Is it okay for people with Down syndrome to get the vaccine?
I strongly recommend that you do. The vaccines have been tested and checked for safety, and in the last couple of months, the COVID vaccines have been given to literally millions and millions of people around the world, and excellent safety reported. So once the vaccine is available, you should get it. It's good to discuss this with your GP. There are several different types of COVID vaccine, but all of them seem to be about 100% effective in preventing severe disease and people having to go to hospitals.
Can the COVID vaccine make me get sick with COVID?
No, none of the vaccines contain any COVID bugs, any COVID virus. So it's actually impossible for you to catch COVID infection from the vaccine. As with any injected vaccine, you can have some mild soreness in your arm where the injection was, maybe a little bit of redness there at times. And this often occurs in the couple of days after the injection's been given. Some people have a little fever the next day, but this really settles down by itself. And if that happens, it's gone in the next day or so.
If I get the COVID vaccine, do I need to still get the flu vaccine?
Yes, yeah, the vaccine's designed only to protect people from COVID-19 infection, and you need a different vaccine to protect yourself from the flu. The vaccine needs updating every year for flu, and it's quite possible that we'll end up needing to have updating vaccines for COVID. but we're not really sure of this. We're just still learning about that.
Where can we get the vaccine?
The rollout of the vaccine, we're trying to encourage virtually everyone in Australia to receive the vaccine, is clearly a huge project. And the government has said that it's going to be free. And the government has tried to work out who needs the vaccine first. And that's obviously the people that are currently catching COVID infection. They need to be the first off the list to get to receive the vaccine. That's only fair. And they've got a list of who should go first and who should go second and who should go third. But generally, it's the people that it's going to make the most difference to that will receive the vaccine first. Your GP will know when you're able to be vaccinated and where you're able to be vaccinated. It'll be a little different answer for everybody. So you need to speak to your GP.
Thank you, Professor Richards.